everyone, Kelly from Back to Life Pain Clinic, and today I wanted to jump on quick before my client gets here, and we'll just talk back pain and some exercises that I do to relieve back pain. As I said in yesterday's video, my back was playing up a bit. I do have a history of a disc bulge that every now and then gives me a twinge, a warning sign, and that gets me straight back into my exercises. Now, it is important to note that not all back pain is related to a disc issue. There are many reasons for back pain, so that's why it's important to see a therapist to determine what is causing the back pain. And I cannot stress highly enough, please do not Dr. Google. Google will give you the most catastrophic diagnosis that will have you sent off for surgery. Just go to a therapist, get a proper diagnosis and the proper treatment. But for today's purpose, disc pain will be constant pain and pain that stops you from sleeping. It will often refer down the leg depending on which disc or nerve is involved. The higher 2, L1, L2 will give you usually symptoms down the front of the leg, and 3, 4 and 5 and S1 will usually give you symptoms into the glutes or down the back of the leg. So first we need to determine which position increases the symptoms. Is it bending forward, sitting, driving in the car, anything that has you forward? Then we want to do the appropriate exercises to release that. If it's standing up or bending back, we need to change the exercises. But for the purpose of this, we're going to assume you've got pain bending forward and that it's pretty much constant. So the first level of exercise, and for those who have trouble getting down on the floor to do this, you can initially do it on your bed. So for some people, just laying flat on your stomach will help start to alleviate symptoms. And in the early stages, you might need to stay here for a while and you need to do it very regularly. The next stage of this exercise would be bringing yourself up onto your elbows, and you can either stay here for 30 seconds and then come back down and come back up again until the symptoms start to release. And then the third stage of this would be the full cobra, and we want to sort of drop the hips down towards the floor or the bed, wherever you are. And we want to repeat these exercises until the symptoms start to release. Now, when you have a back issue, getting up out of bed, we want to roll like a log as quickly as possible. Hook your legs over the side of the bed, and then using your hands, bring yourself to a seated position as quickly as you possibly can. We don't want to stay in a position that's going to aggravate the back for a long time. Now, this is a common thing that I see with people who have back pain when they're getting up from a chair, out of the car, from a seated position. I see people do this. And then they're stuck here. They can't get up. To get up, back needs to stay upright, hands on the thighs, feet firmly on the ground, and push yourself to a standing position so that back is straight as quickly as possible. And same for sitting down. We don't want to stay in a position that's going to aggravate the back for a long time. Now, even if you do not have a disc issue, these exercises will often help to relieve any sort of non-specific back pain as well. The exercise that I showed you the other day on the slant board, or just standing against the wall for 2 to 3 minutes, can also help to take the edge off of back pain. It just improves the posture and helps the back to relax. If the back is really aching, rather than have your feet to the wall, you can take your feet a little ways out from the wall and just stand there and allow the back to relax down. So like I said, please do not self-diagnose your back. Disc injuries do heal. I hear people say I got a disc bulge when I was 20, and they claim that as a diagnosis for the rest of their life, which is often not the case. With repetitive disc bulges, the disc bulge may remain to some degree. And in most cases, a lot of the time, it's non-symptomatic. We can scan 100 people and we'd probably find that 80 to 90% of people have some degree of disc bulge, but it is non-symptomatic. In serious cases, sometimes the disc can burst open, and we will see that in the first week we make 0 changes to the back pain, and in those instances you'll need to go off to the GP and they'll do an MRI to see what's going on in there. But in all my years of treating, I've only ever seen 1 case where the disc had burst. So it's not as common as people like to think. It does happen, but don't jump to worst case scenario. So that's it for today, just a few exercises. I'll probably start bringing you a few more exercises that I do, some of the Egoscue stuff to help start correcting the posture, to try and eliminate back pain from even coming on, or if you do have back pain, to start to ease it so that you can start to move better without pain. All right, so my client's going to be here in a few minutes, so I'm going to jump off now and I will see you tomorrow.